In this session, we will be discussing multiple sclerosis. We will be looking at a brain specimen that was taken from a 66-year-old male who had suffered from an attack of optic neuritis 25 years previously. The patient then had a stepwise deterioration of his neurological state. Radiological examination showed bilateral cerebral white matter lesions, and there were oligoclonal bands present in his CSF. He was wheelchair-bound for 7 years before dying of a urinary tract infection. Macroscopically, we can see a coronal section of the cerebrum here and transverse sections of the pons and the spinal cord. There are grey-brown punched-out lesions, also known as plaque, in the white matter of the cerebrum. As you can see, they are located here as well as here. All of these plaques are periventricular, and we see compensatory ventricular dilatation, which is observable here and here. In the pons, numerous small plaques are also observable here and here. In the spinal cord, there is also a fan-shaped plaque, but it is difficult to discern.
Hello, now I'd like to show you some of the microscopic features of the disease multiple sclerosis, and in particular multiple sclerotic plaques within the brain. Multiple sclerotic plaques often occur near ventricles, or we describe them as having a periventricular location. And what we're looking at here on this low power view is the lateral ventricle, and then next to it is an area of brain on an H&E section where there, as you can see, there's a sort of a loss of this pink staining, and this is the plaque itself. Lateral ventricles are lined by ependymal cells, and if you look at this high-powered section, it shows some of the features of these ependymal cells, and particularly that these ependymal cells have cilia, and it's these cilia and their beating that actually circulates the cerebral spinal fluid. Now, if we look at the normal white matter surrounding this multiple sclerosis plaque, and we look up on this high power view, we can see in the normal white matter there are the two cells that we would expect to find here. One of them is the astrocyte with its medium-sized nucleus and diffuse chromatin pattern, and also we can see the oligodendrocytes with their smaller nucleus but very dense chromatin pattern. However, if we move out into the middle of one of these plaques, the majority of the cells that we see remaining are the astrocytes, and there is a relative dearth now of oligodendrocytes, although there's still the odd one that we can see in this particular section. We can see plaques quite clearly in standard H&E sections, but actually a better way of looking at multiple sclerosis plaques is to use a stain for myelin called Luxol Fast Blue. Now I just want to show you what the normal white matter, grey matter looks like with Luxol Fast Blue. So here is the cortex and the layers 1 all the way down to layer 6. Here's our grey matter, white matter junction. And on this high power view, this is our white matter, and we can see both nuclei of astrocytes and also oligodendrocytes. And if we move over to the grey matter, then we can see the more characteristic looking neurons, which you would be able to identify because of the bit larger nucleus, some cytoplasm around the nucleus, and that characteristic nucleolus. And here's our grey matter, white matter boundary. Now, when we go into the plaque itself, what we see in comparison to this normal area of white matter with those typical features, oligodendrocytes, is that we now see an almost dearth or a relative dearth of those oligodendrocytes. And the only cells that are now really left here are the astrocytes, and that's because multiple sclerosis, the disease process, targets oligodendrocytes, and we lose them, and therefore we lose the myelin that they make. And this leaves us with the characteristic plaque that we see in the brain of someone with multiple sclerosis.